Pharmacy security. Due to the presence of prescription medications, access to, and security of, the pharmacy is very important. The following precautions should be implemented: pharmacy doors should be closed, unauthorized persons should not have ready access. Non-pharmacy personnel should not be allowed to enter the pharmacy unless they are designated and approved to work in that area. Pharmacies should be locked at any time that a pharmacist is not on duty. There may be additional state laws with which the pharmacy technician should be familiar, however, the national examination does not assess knowledge of individual state law. Inventory control. Pharmacy technicians should familiarize themselves with all aspects of inventory control, regardless of individual responsibilities within this process. Inventory responsibilities include medications, prescription containers and other supplies regularly used within the pharmacy, understanding of changes in utilization patterns, and ordering requirements for supplies. Following are components of the inventory process. Receiving. A proper receiving system lessens the likelihood of error and improves the efficiency of the pharmacy. The responsibilities of a staff member responsible for receiving are as follows: patient name and address should be verified, as well as the quantity of the order received. This information should match the purchase order. Shipments must be inspected for damage, and all observations must be noted. Products requiring special care, such as special temperature conditions, should be given priority. Shipments should be inspected to ensure that they exactly match the details written on the purchase order. The following should be checked to ensure the accuracy of a shipment: name, brand, quantity, dosage, and strength. The invoice should be signed and dated by the person who receives the shipment. Expiration dates must be checked to ensure that they are compliant with the pharmacy's standards. Any product on backorder should be brought to the pharmacist's or management's attention to prevent any possible inventory outages. Stocking medications. Once an order is received and processed, it can then be stocked. As this process is completed, careful attention should be given to the following: expiration of new products should be checked against the date of products already in stock, and products should be arranged accordingly so that those with earlier expiration dates are dispensed first. Products should be inspected, and anything unusual, such as broken seals, differences in clarity or color, changes in labeling, should be reported to the pharmacist. In order to prevent stock shortages, prescription patterns should be identified and communicated to members of the team responsible for purchasing. Stock should be examined for damaged products or products subject to recalls. As stock bottles are placed into inventory, label information required by the FDA should be noted. Identifying expired products. The Food and Drug Administration, FDA, during the approval process, works with manufacturers to determine the expiration dating process for medications. Pharmacy technicians have a responsibility to check the expiration date on all products prior to dispensing to determine if the entire prescription is likely to be used by the patient prior to the expiration date on the bottle. Technicians may also be responsible for evaluating expiration dates on inventory received, as well as inventory currently in the pharmacy. Controlled Substances. Controlled Substances Act. Medications with abuse potential are controlled substances, and they are regulated by the Drug Enforcement Administration, DEA. The Controlled Substances Act was passed in 1970 to regulate the manufacture, importation, possession, use, and distribution of certain substances with abuse potential. The Act created 5 federal schedules of controlled substances. The federal scheduling of a substance is determined by the DEA. Though states may have different rules, the most stringent take precedence. Pharmacy technicians should know federal and state controlled substances rules. Federal rules will be tested on the national exam. Differences among the controlled substances schedules. The letter C, designating controlled substance, is used in addition to Roman numerals to identify the potential for abuse and/or addiction of controlled substances. In 1970, the U.S. Congress established the following 5 levels of control based on this potential. Schedule I, CI, includes drugs that have a high potential for abuse, no currently accepted medical use in the United States, and are unsafe for use under medical supervision. These products are not found in pharmacy departments. Examples include LSD and heroin. Schedule II, C2, includes medications having a currently accepted medical use in the United States and a high potential for abuse and physical or psychological dependence. Examples include morphine, methamphetamine, and secabarbital. Schedule III, C3, includes medications that have an abuse potential less than that of medications listed in Schedules I and II. Abuse of these medications may lead to moderate or low physical dependence or high psychological dependence. Examples include morphine and opium combination products. Certain central nervous system stimulants and depressants are also included in Schedule 3. Schedule 4, C4, medications have less potential for abuse than those in Schedules 1, 2, or 3. Abuse of these medications may lead to only a limited physical or psychological dependence. Examples include phenobarbital and diazepam. Schedule V, CV, medications have low potential for abuse and limited physical or psychological dependence. Schedule V medications are any compound, mixture, or preparation containing a limited amount of a controlled substance in combination with non-controlled active ingredients. These products are generally used as cough suppressants or antidiarrheals. Examples include diphenoxin and diphenoxylate preparations. Refills, partial refills, filing, and prescription transfers. Specific protocols have been established by the DEA to be used when ordering and distributing controlled substances. Pharmacies are required to file a specific form, Form 222, which must be completed in pen or filed electronically through the DEA's controlled substance ordering system. If filed using pen and paper, the middle copy of the order must be forwarded to the DEA. Records must be kept regarding quantity and date received, and invoices must be saved for 7 years. Accurate records must be kept for controlled substances and their dispositions. This includes records of inventory, as well as dispensing records. An inventory of controlled substances is to be performed every 2 weeks, at a minimum, as compared to a monthly inventory of regular drugs and devices. The dispensing records of Schedule II drugs must be kept separately from those of other drugs. The records falling under Schedules 3 through V may be filed with those of other prescriptions. Dispensing prescriptions for controlled substances. A pharmacy technician receives a prescription for a controlled substance from a customer, interprets it, and fills it. The pharmacist is responsible for reviewing the prescription before dispensing. If a prescription is called in from a doctor's office, a pharmacist must translate verbal orders into written form, as it is not within the scope of the technician's practice to take phone orders. If a patient would like a prescription transferred to another pharmacy, then 2 licensed pharmacists, or pharmacy interns, must transfer the prescription from one pharmacy to the other. A pharmacy intern can also receive prescriptions by phone. Schedule II medications are only dispensed on a written prescription that has been personally signed by the prescriber. Federal law does allow faxed prescriptions for these drugs for residents in long-term care facilities, hospice patients, or for parenteral narcotics used for a patient by a home infusion pharmacy. In a hospital pharmacy, control sheets are to be maintained that indicate the time of administration of Schedule II drugs, as well as the patient to whom they were administered. Some states may have more stringent rules governing prescriptions for Schedule II medications. Prescriptions in Schedules 3 through 4 may now be submitted by telephone, fax, or email. These prescriptions must be taken by a pharmacist or by a pharmacy intern under the direct supervision of a pharmacist. When received, electronic orders must be written on a paper prescription form for filing. The presentation of a hard copy prescription to the pharmacy is required. Some states have requirements for the number of copies, or even the type of form presented. It may be necessary to confirm a patient's identity before dispensing these medications. Refilling prescriptions for controlled substances. Prescriptions for controlled substances of classes 3 and 4 may be refilled up to 5 times and within 6 months after the prescription's date of issue, if authorized by the prescriber. No refills are allowed on a prescription for a C2 drug. If the entire amount is not available at the time of presentation, the remainder must be dispensed within 72 hours. If the drug is not dispensed within that time, the prescription is considered expired, and the balance is voided. These regulations may differ from state to state.